I've learned to never miss an opportunity to have a captive audience. So shameless plug for our center. I want to let you all know, faculty, students, and even other folks that are interested in research. We have a wonderful center that's staffed by many of my students that are here already, where we bring researchers from different disciplines, from environmental health, animal health, and human health together to go after and tackle complex problems. We have an annual One Health case competition that we're always looking for more students to engage in, so please keep that on your radar. We've got an Instagram account. Follow along. Everyone get your phone out. Okay. And so what I want to talk to you guys today is a lot about One Health. I'm going to speak a bit about some of my research, but I want to keep it about my philosophy and where I view One Health as the director of the One Health Center of Excellence. And so as you can see, this is the triad behind me for healthy animals, healthy humans, and healthy environments, and all three of those are necessary to have a healthy ecosystem. And then successful One Health interventions often require the collaboration between people from these different disciplines. And so, it sounds great. There's a lot of we can do it together aspects, but I'll also talk about some of the drawbacks and challenges within this space. But why One Health? Why does this really matter? We have rapidly changing climates, habitat loss, deforestation. A lot of this is driven by rapid population growth. There's a finite number of resources that we all are trying to use and live by. And then, of course, we have the spread of AMR. We have overcrowding. There's a lot of things that are making this world a little bit more complex. And I'm going to talk about that later when we discuss wicked problems. But where I operate, and I like to think about One Health from my view, with public health emergencies of international concern, a PHEC. We've only had 8 of them, and those are potential infectious disease outbreaks that have a high risk of international spread. 7 of these are, by definition, a One Health issue because they have animal reservoirs, they have human hosts, and there's environmental changes that have happened that have driven their emergence. Polio is the only one that would fall a little bit outside because it's human to human, and then there's environmental reservoirs. But another way I like to think about this risk of spillover is this is the Swiss cheese model. So I love Swiss cheese, and then I love the Swiss cheese model. And we all need to be thinking about risk in this way. There is no way to zero out risk. There will always be risk. There will always be a risk of another pandemic. It's not if, but when. And so our jobs as public health professionals and research scientists and clinicians is to think about how do we shrink these circles? How do we shrink the circles from what's happening in reservoirs, what's happening in exposure, what's happening within host dynamics, how can we get a therapy in place? And if we have enough risk in place across all these domains, which stretch across One Health, then we have this star aligning event, and we have events like the SARS-CoV-2 pandemic. And of course, within One Health, about 75% of all emerging infectious diseases are zoonotic. So it brings in that animal component in our shared environments. But I'm going to pivot just a little bit here and talk about tame and wicked problems. I spent a lot of time thinking about my philosophy. So tame problems aren't easy. It's not, tame doesn't mean easy. It just means we know how to do it. We know the answer. If you're going to have surgery and it's fixed femur, there is a roadmap to follow. There is a successful outcome where the surgery was successful or it wasn't. I'm not going to get into the complications of our previous time. I know, now I'm like, man, why did I use this example? But we have an idea of what, for the most part, what's the roadmap to follow. Wicked problems, though, are socially complex. There's not really a right answer. It's about moving the dial. It's about trying to not just find an answer, but to create a shared understanding. So there's not a quick fix for wicked problems. There's no completion date. It's a management and mitigation approach, and it's highly specific to time, place, and space. So you can't say, this worked here, so therefore no matter what, it'll work in this context. And One Health is really focused on trying to tackle these wicked problems. And so if it was if a single discipline could solve it, they would have. And I used some AI, because we're always encouraged to use AI. And I was writing my philosophy into AI. I'm like, well, I think it's a stool. And although we had a great explanation of these pillars, I should have probably done pillars for Pillars Day. We're going with stool, and I'm sticking to it. So I think of it as this 3-legged stool where you have human, animal, environmental health. And while all 3 are essential to balance, the length of each leg has to meet the floor where it's at. right? So if you're doing a zoonotic disease outbreak, your focus on animal health might be a little bit longer. If you're doing an emerging toxicant threat, then you're going to be focusing on environmental health. So it's not about having all three legs equally represented. It's about finding a level seat, regardless of the challenge, a surface that you can sit on. And this is probably maybe not the most popular opinion, but we have this risk with calling everything One Health. If we call every single thing One Health, it begins to start to mean nothing. And so I think it's important that we recognize the importance of other disciplines. But if we start adding more legs to this stool, it's no longer a functional piece of furniture. And so I like the analogy, if you've got this stool, it's, we stay and committed to these three legs, but that doesn't mean you can't put it in different rooms. It doesn't mean you can't put it in a room of social science. You can't put it in a room of climate science or economics or policy. But what really matters is, can we get decision makers to sit down and think about it, and what are the implications of One Health on those external factors? And so, we've talked about this lofty idea, and so here's what I think and how I apply it. This is from our project in northern Kenya, where we're looking at Rift Valley, Crimean Congo, and tularemia. And what we did here is we tried to map out all these different risk envelopes for pastoralist systems, from the household level to their livestock, to the environments that they're entering, from vector exposures, the wildlife coming in and out. We were doing serological monitoring for exposure, PCR for active infection, and the ultimate goal was to try and map out what's happening with risk dynamics, who's at more risk, what behaviors are more at risk, what's happening within this value chain, and eventually connect it to the clinics that were in this space to inform them of potential outbreaks, and finally have that translate to policy. And it seems like chaos, and it was chaos, but we did our best because we were trying to make sure that we were covering all of our grounds, and this was a true One Health project. And that's where I'm going to talk about some of the challenges and obstacles. It's not always easy to get people to sit at the same table. We will agree to collaborate, we will high-five in the hallways, and then the Excel sheet for budget comes out and the knives are out. We have to be, okay, well, there's only so much pie. There's only so much water in that well. We have to move away from that and think about water, in the lake, that we're all just trying to go to this larger source. And if we start competing against each other, we're actually going to end up harming ourselves in the long run. Then we also have to think about policy and rolling it out. If you're really focused just on this human component and you're working with ministries of health, and that policy isn't actually being adapted at a county level, or it's not being adopted by agricultural communities, then you're only getting half that picture, and it's actually a less successful intervention. And then my last part's about just research infrastructure in general. We need to have more balance here. There's this tendency of putting up another BSL-2, put up another BSL-3, get another sequencer, and then you go and you visit these labs, and a lot of them are covered with the plastic tarp. How can we get better at streamlining and maximizing those use and providing equity to countries that are adjacent, or communities of scientists that want to use that equipment in ways that you're maximizing impact without telling them, this is ours, it's our service plan, you got to get yourself. And that's also going to hinder and limit our group science here. So I stole this from my colleague, Dr. Yvonne Linton, at her presentation last week, so I'll at least attribute to her. But your data and decisions actually move at the speed of trust. Different disciplines don't always trust each other's motives, communities don't always trust how their data will be handled, and meaningful partnerships don't occur overnight. And that's why I like One Health so much, because if you have this multidisciplinary thinking and you have this broader range of expertise, you can connect with other people faster. You can build that bridge of trust at a faster rate when you've had that shared suffering. When even if I'm an infectious disease epidemiologist, and my PhD students wouldn't believe it, I was in the lab at one point, and I talk about back pain and how I hate this assay, and so I was like, I hate that assay too. Let's work together. You have to have those shared experiences, but if I hadn't had those experiences, I would be less able to connect with them, and it takes longer to build that trust. And so what we believe here within our One Health Center, within our department, within our degree programs, is we really want to make these T-shaped professionals. A career in One Health isn't just for clinicians or epidemiologists or veterinarians. It requires us to have specialized areas. You need to have something you're good at. But you also need to have diverse skills that can be applied just a little bit further beyond your area of expertise. So we've heard this this saying? So a jack of all trades is a master of none. Everyone has heard this? Can anyone tell me what the full quote is? Does anyone know the second part of this quote? So it's on this side. I'm getting turned around here. A jack of all trades is a master of none, but oftentimes better than a master of one. And we've almost turned to that jack of all trades. I'm a jack of all trades. And it's, I don't have anything. Well, in fact, you have a lot to offer. And you have a lot of different perspectives to offer from your lived experience of all these different things that you've been working with. And so we really need to be training our next generation of students to not just, don't shy away from specialization. Don't shy away from becoming a true master of your craft, but go take that GIS class. Go learn how much you dislike pipetting in the lab, because then you'll know when you have those conversations and it's time to build trust, you've experienced some of those things. And so in my role as the director, I really want to create a space where we can bring like-minded individuals together to go after these consortium grants, to tackle that big picture that health doesn't exist in a vacuum, and that we're directly influenced by the relationship with animals, our other humans, the environments we share. And we have to fight that tendency that says this is a human problem, this is an animal problem, this is an economic problem, and we're just going to fit right into our silos, because we've gotten really good at answering how things work within our respective disciplines, within our tame problems. We've really gotten good at managing tame problems. But we are often missing the space between the systems that we operate in and how do we get better at addressing these wicked issues. And that's where I believe that One Health and One Health thinking thrives. So thank you.